Ontario, and he's kindly agreed to speak to us from Toronto early on a Sunday morning. Dr. Schabas, thanks for your time. Really appreciate it. Over the last few days, medical officers of health have argued the government perhaps isn't being stringent enough when it comes to containing the virus. Let's talk about how you would rate the governments, and we have the federal government, of course, and provincial governments as well, but can I get you to talk about your assessment of government response?
That's a huge question. I feel like governments, not just in Canada but around the world, are caught in this kind of high stakes poker game where they can't fold, and when somebody else raises the bid, they just have to match that. And I don't know where these measures are going to end, but in fact I have a very different feeling on what is going on. I realize I'm a minority, a very small minority. I think we have fundamentally overreacted to this problem. I think we have fundamentally misjudged the magnitude of the problem. The reality is that in no country, including Italy, has the death toll so far come anywhere close to what we would expect from an average influenza year. And I think there's no particular reason to expect that to happen here in Canada. There have been stresses on hospitals in the areas that this disease is concentrated, because one of the key differences between COVID and influenza is that it is much more geographically concentrated for reasons we don't begin to understand. I mean, we could talk for an hour about all the things we don't really understand about this virus. So, in fact, for a healthcare system to react to it, it's not so much a question of total capacity, it's a question of distribution of capacity. And that I think is going to be the challenge here in Canada as we get an outbreak. We talk about hundreds of cases. The reality is, if we've had 20 deaths in this country, 19 deaths, because the case fatality rate is about between 1 in 300 and 1 in 500 in all probability, that means that 2 weeks ago we had 5,000 or 6,000 cases. We probably have more than that now. So it's out there. We're going to have to deal with it. I'm just not quite sure what we think we're going to accomplish through this flattening of the curve. Maybe we can do it. The evidence that these are lovely graphs circulating on the internet. They're beautiful to look at. They're very impressive. They're based on very weak evidence about what impact these measures will actually have. But even if they do have that impact, the virus isn't going anywhere. So Korea's finding that out now. So when does all this end? I mean, what's our strategy? What's our end game here? When do our kids get to go back to school? When do people get to go back to work? Because we're learning very quickly how unsustainable these measures are, and we've only been doing it for a few days.
All right, there's a lot to unpack there. Let's try to unpack some of it. Is there, to use the metaphor of flattening the curve, is there a curve in concern, a curve in fear that you would argue is going to have to flatten as well in terms of trying to accept this? Is that what you're suggesting?
Yeah, absolutely. I think we have totally spooked ourselves for two things. I think, first of all, the situation in Italy, which is frightening to look at, although we should remember that Italy is a large country that is very susceptible to respiratory viruses, probably primarily because it has a very old population. So Italy gets on average 17,000 deaths a year from influenza, and they had an outbreak of influenza 3 years ago that killed almost 25,000 people. So we need to take the Italian situation in that context. The second thing that's happened is we've seen all of these mathematical models which are predicting apocalyptic consequences that don't actually resemble in any way what's happened in the first 4 months. Now somehow we're supposed to believe that in the next 4 months the sky is going to fall. And the problem with there are two problems with these mathematical models. First of all, they are only ever as strong as their inputs. They garbage in, garbage out. And unfortunately, there are some key parameters of COVID that are really not very well understood. Things as basic as the case fatality rate or the infectivity, what we call the R0. So the models have a huge uncertainty. The second problem with the model is the modelers. The modelers, who are the very people who should understand the frailty of their craft. When they present their models, should say, this is what our model says, but by the way, you should know there are huge uncertainties because they've all crafted models in the past that were wildly wrong, as well as some that may have been right. Instead, they have been the most zealous about promoting about sowing fear and these sort of cataclysmic consequences. We're going to see lots of cases in Canada. We're going to see deaths, tragically. But I think it is very unlikely that we are going to see anywhere near as many deaths here in Canada as we have already seen from influenza this year. We need some sense of perspective.
Okay, Dr. Schabas, just in the time we have left, because I'm sure you're aware that you're a bit of an outlier in terms of what we're being told by governments and public health officials across this country. So the average Canadian who are trying to self-isolate, or at least trying to remain their 2 meters away from everyone else, and who may have supplied food and toilet paper, what do you tell them in terms of how they are going to move forward for the next weeks or even months?
Well, I think Canadians should do as they're asked to do within reason. I think we are all respecting the self-isolation, or the 2 meters of the social distancing and all of that. In many cases, we have no choice. But I think Canadians should also continue to think critically. We're learning more about this. We're seeing the situation around the world. Don't get spooked by the numbers. The world is a very big place. Don't get spooked necessarily by the fact that the curves are still increasing exponentially. That's what happens in all infectious disease outbreaks. They increase exponentially, they peak, and then they decrease exponentially. So that's what's going to happen here too. Let's continue to question, let's continue to challenge, and let's push our government to stay on top of this and to stay calm.
Dr. Schabas, perhaps a little light at the end of the tunnel you've offered us here today. Thank you so much for providing your experience and your perspective.
My pleasure.
Dr. Richard Schabas is the former Chief Medical Officer for the province of Ontario.